Welcome back to Silicon to Software. I'm your host, Imran, 20 plus years in PCB and hardware. Today, we're going inside the human body. Let me give you a real example. There's a woman, late 50s, and she's got a device the size of a grain of rice that's been living under her skin for 3 years. This past Tuesday morning, before she'd even finished her coffee, that device caught a glitch in her heart rate. Logged it, time-stamped it, sent it straight to her cardiologist. She felt nothing. That's not a pitch deck. That's happening right now in real patients. Most people hear implantable medical device and think pacemaker. That's fair, but it's just the start. We've got brain stimulators for Parkinson's, cochlear implants, glucose monitors, neurostimulators for chronic pain. But here's what's actually changed. It's not the list of applications, it's the sophistication underneath them. These devices are running custom chips, wireless radios, on-device AI, all on a sliver of power inside a human body for years at a time. Let's get into the engineering because this is the part that rarely gets covered. These enclosures have to pass a helium leak test that's tight almost to the point of absurdity. The seal has to hold up better than most spacecraft components. And it's not for a single mission, it's for a decade. Inside saline, inside a body that's moving constantly, sitting at 37 degrees, surrounded by enzymes actively working to break it down. Inside that sealed shell, engineers are packing serious density. Circuit boards with over a dozen layers shrunk down to something smaller than your fingernail. Some designs are moving away from the stacked board entirely, and instead, the chip, the wiring, even the antenna, all sit fused into one hermetic module. Less bulk, more performance. Now, the battery. This is where engineers really lose sleep. Most of these devices run on a cell you can't recharge. When it dies, the patient goes back into surgery. That's real risk, real cost, real disruption to somebody's life. So the industry's attacking this two ways. First, wireless charging through the skin. It works, but only near the surface. Push into deeper tissue, and efficiency falls off fast. The more interesting angle, at least to me, is what's happening at the chip level. New process nodes are pushing standby power down close to nothing. Some lab work is landing in single-digit nanowatts. Think about what that means for a design. That's the difference between swapping a battery every couple of years or barely thinking about it for a decade. So what are these devices actually sensing? Brain activity, neurotransmitters like dopamine, pressure and flow inside the heart, real-time pH after surgery. And here's the clever part. Instead of streaming raw data constantly, which drains the battery fast, modern chips classify the signal locally. They send the conclusion, not the raw waveform. That distinction matters because it's the radio, not the compute, that drains the cell fastest. That's the part that tends to surprise people when I explain it. Now here's what still gets me, even after decades in this industry. Some of these devices don't just sense, they act. Take adaptive deep brain stimulation. The device is recording, listening for a specific beta band pattern tied to Parkinson's motor symptoms. And when it detects it, it adjusts the stimulation in real time. No clinician at a keyboard making that call. There's published research on a device doing something similar for treatment-resistant depression. It watches for a patient-specific biomarker, and when that signal crosses a threshold, it fires a short pulse to the target region on its own. A mental health intervention, running quietly inside someone's skull. That's worth sitting with for a second. None of this holds up, though, if the body rejects the hardware. So there's an entire discipline built around biocompatible materials, medical-grade titanium, specialized elastomers, ultra-thin conformal coatings that form a near pinhole-free moisture barrier at the molecular level. And then there's getting the data out safely. These devices use radio bands specifically allocated for medical implants. And because they're genuinely networked now, cybersecurity regulation has had to catch up. As of earlier this year, manufacturers are required to demonstrate secure software and prove they can push authenticated patches after the device is already implanted. Given the real exploits researchers documented in older devices a decade back, that update was overdue. Looking ahead, brain-computer interfaces are the headline. Companies are already implanting devices to help paralysis patients communicate. Progress hasn't been perfectly smooth. There have been real setbacks along the way, but the trajectory is clear. And one more trend worth watching: bioresorbable electronics. Implants that do their job, then simply dissolve in the body. No removal surgery required. You probably won't need a brain implant. But the shift from seeing a doctor twice a year to being continuously monitored is already here. That circuit board smaller than your fingernail isn't a curiosity anymore. It's becoming infrastructure. For the full technical breakdown, the standards, the sourcing, the data behind everything I covered today, head to silicontosoftware.com. Until next time.